All right, so welcome everybody. For those who are new to us, my name is Rosanne Corcoran. I'm the host of Daughterhood, the podcast. I'm a circle leader, and I was my mom's primary in-home caregiver during her journey with vascular dementia. At Daughterhood, we provide a safe haven for caregivers like you to connect, gain knowledge, share your experiences, and most importantly, realize that your feelings are not just normal, but also valid. We understand that the system is not set up for you, and that's why we're here, ready to support you every step of the way. We welcome everyone to today's guide topic circle. We're very fortunate to be joined by Amanda Willliams, head of clinical operations at our partner organization, PocketRN. Amanda brings a wealth of experience and insight, and she's here to walk us through what guide is all about, including the enrollment process, the key benefits it offers. And after Amanda's presentation, we'll open the floor for questions. So feel free to jump in then. If you prefer to drop your questions in the chat, please feel free to do so at any time. And Amanda, I will kick it over to you.
Yeah, thanks, Rosanne. Good morning, everyone. What a pleasure and honor it is to be here with all of you today. So thank you for having me. And my name is Amanda Williams, obviously, as Rosanne mentioned, and I am the head of clinical operations for PocketRN. And today we are going to talk about the guide program, and super excited to be here and talk about this program. Just a little bit about myself is I'm an RN by trade. That's my background. And since leaving the bedside, well, I thought I'd go into nursing education and mold the minds of the new nurses that are coming into the profession and make them strong leaders and advocates. And when I was finishing up my program, I thought, I'm not sure this is for me. I don't know if I want to stay in academics, and I have to do research, and that didn't sound like a lot of fun. So I thought, oh no, I made this huge mistake. I just spent all this time and money on getting this degree. So I decided I'd be really open when I was applying for jobs after finishing up my program, and it was honestly the best decision I could have made in my career, because it sent me I had this chance opportunity to land in I'm based in Omaha, Nebraska. So it was Nebraska's first accountable care organization. And maybe you don't know a lot about accountable care organizations, but what happened there was I just started to learn about kind of our broken healthcare system. And it made me open my eyes to a lot of questions that I had as a nurse on the floor of, why do we do things this way? Why do we allow these things to happen? And I really started to understand what drives a lot of our healthcare processes. And it's really around who will pay for the care, what kind of care will they pay for, who won't pay for the care, right? And so this really set me on this career journey of, this is broken and it needs to be fixed, right? Like someone needs to get in here and start turning the ship and making this better for our patients, those living with the illnesses, their family caregivers, and the nurses and the medical staff that are taking care of the patients. So um, the guide program fits perfectly. I feel like it's sort of a culmination of my career and really where my passions have been. This is the first program from Medicare that I'm actually excited about. I think it brings real change and real innovation to the space. And again, there's a lot of support for family caregivers that we will talk about here moving forward. So again, just an honor to be here and talk about this program with all of you. So thank you for having me today. So Rosanne mentioned the tech issues. So here's the test. Rosanne, can I share my screen without having any tech issues?
Give it a
And
shot.
all right, here we go.
There you go.
Okay. Whew, all right. We got through that hurdle. Everything else is gonna feel easy from here on out, right? Okay, so everyone can see my screen okay? Awesome. All right, well, I'm going to go ahead. GUIDE stands for Guiding an Improved Dementia Experience, if anyone was wondering. And this is what we're going to dig into here in our time together today. I'm going to go ahead and just move through the slides, but I think probably okay for people to drop questions in the chat, and we can definitely pause if anything comes up in a moment. We'll keep it real flexible. This is your time here today to learn about this program and explore any benefits that you feel like it might bring to you or your family. So the main points that we'll cover today: what is PocketRN? Probably curious to know kind of who we are. we'll talk about the GUIDE program, eligibility for the GUIDE program. We have a quick case study we can look into, and then we'll talk about how to sign up for the program. Okay, so PocketRN. I feel, again, just so lucky to be one of the nurses that was chosen, honestly, to be a part of the PocketRN team. What we are doing here is, I think, truly different and truly innovative, and just makes a ton of sense, quite honestly. And it's probably a gap that we've had in our healthcare system. We are really a company with a mission. We have big goals. We really want to impact really the care delivery model in healthcare in our nation today. And GUIDE is a great vehicle that we have for that. And at the forefront of that are our nurses. So in essence, we are a nurse-led care delivery model, which is a mouthful. But I would say traditionally what you see is a provider, a physician, a doctor who has kind of the nurses under them, right? And at PocketRN, we've kind of flipped that model where we have nurses. That is really who drives the care that we provide for our patients. We do have a chief medical officer on our team, and he's amazing. We all love and appreciate him. But this kind of flips the model a little bit, where the nurses are really in charge of providing the care and managing, I always say managing the patient through their journey. And it looks a little bit different than traditional healthcare, of course. We are a virtual nursing organization. So at this point in time, we don't have what we would call, quote unquote, boots on the ground nurses. Not saying we wouldn't ever get there at some point in our journey as an organization, but today we provide virtual nursing services. And this is really where the GUIDE program comes in and aligns really nicely with who we are as an organization, the mission that we've set out to do. And then again, you just kind of that vehicle of making care convenient. So we have four main building blocks. Your nurse for life, which I am one of those nurses. I have several patients, we'll say patients and families that I meet with on a continuous basis. Some of them I can't let go of. We've just built a really great relationship. And so I'll probably be seeing them for the duration of our time together, because I probably won't let another nurse take them. So we have your nurse for life. We'll talk a little bit more about what that means specifically to GUIDE, but really what we believe everyone should have a nurse in their pocket, right? Because as you go through some sort of health crisis, or you're facing a new diagnosis of a chronic disease, for example, sometimes you just need a little third-party validation, and that's where one of our nurses can come in and be handy. Sometimes you need help navigating the healthcare system. I mentioned before, it's broken. It's hard to know, your next steps. Sometimes you might feel that your voice is not being heard. And so having a trusted partner and a trusted advocate on your journey through whatever you may be living or facing in the moment is obviously something that we believe everyone should have. And that is really through our nurse-led care delivery model. Everyone should have a nurse in their pocket. Our care model, again, I kind of jumped ahead and talked a little bit about that. It's kind of flipped from what we see in a traditional setting, where the provider really kind of leads the care. The nurses are kind of at the top here, and the provider is a lesser part of that. We consult a lot with our providers. So I'm going to say he doesn't have any, say, but he really allows us to use him more for consultation and help us kind of guide again and navigate and take that journey and really own it. We have a technology platform. So convenience is really definitely a part of what we think PocketRN has a lot of value because it's hard to, depending on what you're dealing with, it can be really difficult to get in the car, get someone to a visit, or get yourself to a visit. You might be juggling, caregiving for a loved one, plus young children, plus you're managing your own life, and making all of these pieces move and align all of those things so you can get someone to see a nurse in an office in that traditional healthcare setting can be really difficult. So we have a technology platform that we use where you as a family member, caregiver, can be, down the street, you can be out of state, but you can still join join the meetings very easily with your loved one. And then just this idea, the fourth kind of pillar here is operational excellence. We really do strive as an organization, I believe, this is really baked into the ethos of who we are, is constantly striving to be better, constantly improving our process. So we are impacting the patient or family caregiver in a more impacting that patient experience in a positive way. So that's a little bit about us and who we are. And we're going to talk about the GUIDE program. So again, GUIDE stands for Guiding an Improved Dementia Experience. And this is a program through Medicare. It's actually the Centers for Medicare and Medicaid Innovation, if you're familiar with them at all. What this I guess, offshoot of Medicare does, the Centers for Medicare and Medicaid Innovation, is it's testing new care delivery models. So it's really trying to innovate our current healthcare system. And so they are designing these different programs, and then depending, usually for CMMI, I guess they're usually voluntary. So us as an organization, we had to fill out an application essentially and say we want to participate in this GUIDE program with Medicare. Again, it's for people with dementia, and there's a large emphasis on the family caregiver. The intent and purpose of the program is to keep patients at home safely for as long as possible. And then again, we are a virtual nursing service organization, so we deliver the GUIDE care virtually with our expert nurses on staff. Should I keep going? I think I saw a couple questions come through the chat. We'll stop at the end and do, okay.
No, you're good.
Okay, all right, we'll keep going. Thanks, Rosanne. So GUIDE is a 7-year Medicare demonstration. Again, there is a kind of a time cap on this program, and we do expect to see if we get the outcomes that Medicare wants. We do expect them to actually make this a long-standing permanent program. But again, this is through the Centers for Medicare and Medicaid Innovation. So they're kind of testing these new care delivery models. But 7 years is a long time. And I always like to say we made it through the DOGE cuts. So I was a little bit nervous when DOGE came through, but we have several contacts at CMMI, and this was a program that was very favorably received by the members of DOGE. And we know dementia particularly will be a very pressing and chronic health issue that we will see in our nation in the next like 10 to 15 years. More and more people will be diagnosed with dementia, and the cost on our nation related to this increase in diagnoses will be a lot. So they are really trying to put a framework around this again to see how do we help manage this and keep these patients at home and keep their family caregiver supported, because you all know it's a lot of most of this lands on the family caregiver. So let's talk a little bit about who is eligible for the GUIDE program. This is for individuals diagnosed with dementia. Can be Alzheimer's. Rosanne, I think you mentioned vascular dementia, really any type of cognitive impairment that meets the criteria for dementia would qualify for the program. The individual must be enrolled in original Medicare or traditional Medicare Parts A and B. I think when we, as an older adult, when we sign up for Medicare, we think Medicare is all the same. It's not. There's a big difference between traditional Medicare and then the Medicare Advantage plans. So anyone who has Medicare through one of the larger or smaller private insurance companies like Humana or Blue Cross Blue Shield, that would actually be a Medicare Advantage plan and would not qualify for this program. We do run eligibility on everyone that's interested in the program to make sure that we are confident that they have that traditional Medicare coverage and would be eligible. Some exclusion criteria here at the bottom. The individual cannot be living long-term in a nursing home or a nursing facility. And if they are on hospice, they will not be eligible. So if they have enacted that hospice benefit, that would actually take them out of the guide program and make them no longer eligible. VA patients, dually eligible Medicaid patients, unless you have PACE, but if you have Medicare and Medicaid, you would qualify. Memory care patients and patients on palliative care would also all qualify for the program. So just kind of a general overview there. Again, I think the important thing to know is if you have a loved one with this diagnosis, we would run your eligibility check to make sure that we feel pretty confident that you would be accepted into the program or not. Ultimately, what really needs to happen is you meet with one of our nurses. We have to go through, it's called a comprehensive assessment, and that's a term from Medicare, and they aren't lying when they say comprehensive. It is very comprehensive. We have to ask a lot of questions, gather a lot of data. We submit that to Medicare, and then ultimately they tell us if the individual has been accepted into the program or not. So there's kind of a first step. We check the eligibility, and then we have to gather all this information, and then we send that to Medicare, and then they tell us yes or no. Kind of high level overview, some benefits of the guide program. Once you have someone enrolled in guide, once someone gets enrolled in guide, they receive their nurse for life for free. This is covered by Medicare. There are no copays or out-of-pocket costs. So this is essentially a free program. You have really on-demand access to a nurse. So Medicare does say we need to be meeting with you so often or having so many touch points with the individuals in the program, but you can reach out to us as well if you're like, hey, I could just speak to a nurse. It doesn't mean you're going to get connected to your nurse for life. It might be one of the other nurses that we have on the team, but that is an option as well, as that we call it that on-demand access. So that quick access to a nurse, because again, our mission here is really to put a nurse in everyone's pocket as they're going through whatever journey you're on. Again, we touch base regularly. There's a medication review. This actually all goes through our providers. So we have one physician on staff, and then we have nurse practitioners. So to get into the program, we have to review everyone's medications. And we don't prescribe or de-prescribe, but we might offer some consultation on, medications, especially as we start meeting regularly and kind of understand, really what today looks like, behaviors, things like that may be related to dementia. There may be some consultation and things we can offer around that. And then we'll help manage other chronic conditions like, diabetes, CHF. So anything on top of that dementia diagnosis that the individual might have, we can also help the individual themselves, and then also the family caregiver manage some of those other like clinical conditions that they may have on top of that. The family caregiver benefits, I'll just mention the first one. We've partnered with Daughterhood to bring support to the family caregiver in a way that I think just is so meaningful and impactful, and just really help bring that, that another level of support. You have your PocketRN nurse for life, and then you also have access to Daughterhood. We also have partnered with a company called Navan, and they have basically modules that you can do on your own time. If you're a little bit curious or you feel like unequipped, like you don't know much about dementia and you want to learn more about the diagnosis, we have modules that we can, provide to you, again, free. There's no cost to this, that you can sit down on your own time. And I do them on my phone because I did them too. So I just kind of do it on my phone when I have time, and that can just help you feel a little bit more equipped and maybe a little bit more confident in the care that you may be providing for your loved one.
Amanda,
Yeah.
jump in. Someone has a question on eligibility.
Yes.
Her mother has Blue Cross Blue Shield MedX as supplement insurance. Would that disqualify her?
If it's Supplement, that's what I'm not sure about. I think we would want to check eligibility and just make sure. But it does sound like that's a Medicare Advantage plan. So I do think it might impact the eligibility there. But I would say let's run it and make sure, because I just think that's where we have the highest degree of confidence
Yep.
if we believe someone would be accepted or not based on insurance.
Great. Thank you.
Yes, Nicole. Thank you, Nicole. I do think so. Yes, supplements are different, but again, there is a lot of confusion. I mean, even if you're in the industry, there's a lot of confusion about Medicare versus Medicare Advantage. So I just think that eligibility check is a really important first step.
Okay. Okay.
Thanks, Rosanne.
Sure. Sure. We do have a couple. Uh, how long does it take for approval?
Yeah, so this is kind of generally our flow, I guess I'd say. We once there is an interest identified, and I'll say you become known to our organization, we will schedule you for a welcome call, where you will meet with someone from the PocketRN team. We will gather the necessary information, like the insurance information, for example, run that eligibility check, and make sure that we feel like you would even qualify based on the insurance provider. We have to gather some information, of course, during that call, and then they will schedule the comprehensive assessment. So that's usually within a week or two, just depending. And then once you complete that comprehensive assessment with the nurse, and we provide that information to Medicare, they have committed to letting us know within 15 days of receiving the information of who will be accepted into the program or not. So it's usually pretty quick. The caveat to that is they only want us to send the information every 2 weeks. So it's about a month after. Yeah, I know. Um, it's Medicare. These are just things that we have to deal with, honestly. So I would say, within 20 to 30 days after the comprehensive assessment, we generally will know, and we'll schedule another visit at the time of the comprehensive assessment to make sure you're moving through the journey as fluidly and seamlessly as possible.
Okay. Okay. And I apologize, technical stuff over here. There were
Yeah.
more questions, so let me get to them. Regarding PocketRN, how do your clients pay for your services? Are you a concierge health provider?
We No, not today, but I do believe that will be an opportunity very, very soon. We had our, I guess, sort of building out that aspect of PocketRN. I think we have to get this guide program. We start guide officially. I didn't say this and I should have. So we start guide officially July 1, and this is when we can start working on getting people accepted into the program. So July 1 is our start date with Medicare. We can't really do anything until that date. And then, so I think we're gearing up for this, getting started. And then I think we do have sort of this whole concierge side of things that we need to look at and begin building out. So,
Okay.
great question.
And how does it differ from other healthcare group services? Like,
Um, I'll say generally, I think let's compare it to kind of your traditional healthcare. You might have a good relationship with your care team, but you probably don't see them very often. They're probably difficult to get in touch with. You're definitely not meeting with them on a regular basis. You might be sending messages through the portal, for example, through your EMR. But it's pretty short, and I think it's I'll say more of that responsive mode rather than let's be proactive. Let's work through this journey together. Let's meet on a frequent basis. We can meet monthly. We can meet every week if there is an exacerbation or, a triggering event like a hospitalization, something like that, and you just need a little extra support through your journey. So we can flex up or down really depending on where things are at. Sometimes things are okay and everything's kind of in, status quo or maintenance mode, and you don't need us as much. That's great. Good. But that's really what we want, right? But when things change and you need that trusted partner with you, then we can be more present and more there with you. So That's, I think, a model that you're not going to get from your like primary care physician or anyone in their office, really.
Okay.
So I think I would say that's one of the main kind of differences.
Okay. No, that's great. Medicare Advantage is not included. Why? And do you think they will be at some point?
Great question. Medicare, typically what happens is Medicare is really trying these new models, testing these new models. And if they see the outcomes they want, the Medicare Advantage plans will definitely follow. We know that there is a lot of interest from Medicare Advantage plans right now. They are following it very closely. Honestly, right now, more from a competitive advantage for them because there is just a lot of in that space with Medicare Advantage. It's they try to be more, commercially marketable than Medicare, traditional Medicare, for example. So a lot of plans, big plans, big companies do have their eyes on this and are following it very closely. So I wouldn't be surprised. I don't have the crystal ball, but just from what we're hearing, I wouldn't be surprised if that does happen and maybe sooner rather than later.
Okay. And being on hospice, you cannot sign up for the guide program. I'm assuming because they figure you have the support in the hospice program or how to.
Yeah,
Okay.
yeah, yep, yep. If you have enacted the hospice benefit, it actually removes you. So at any point, if we would join guide and then you transition to that hospice status, then it would remove you from the guide program, which is honestly hard for kind of heartbreaking for us, but we'll figure out that transition if that happens because we
Right.
don't want you to lose your trusted nurse.
Okay. And to be clear, the guide program through PocketRN is different from contracting with PocketRN to provide services. Correct?
Yes, correct. Yep. We don't have a like direct consumer or concierge model at this point in time. So right now, it would be you would have to be enrolled into the guide program and uh and or I mean we work with home care partners. So oftentimes if you would be a client of a certain home care agency, for example, you might receive PocketRN services, but there's no direct to consumer route today.
Okay. Okay. And palliative care is allowed.
Correct.
Okay. Okay. Thank you.
Yeah. Great questions.
Yeah.
Active group. I love it.
Absolutely. Always, Amanda Rowe, you're going to get
I
more.
told Roseanne, okay, I was like, I hope I can answer. She's like, this is a good group. I'm like, I hope I can answer the questions.
Yeah.
All
Yeah.
right.
Exactly.
All right. Well, let's keep moving on. So why PocketRN for Guide? Again, I think this program really aligns with the mission of PocketRN and sort of again who we are as an organization and just what we've really set out to do. PocketRN care delivered by nurses with 10 plus years of experience specialized in dementia care. I am one of those people that works on hiring and recruiting our new nurses. We are very selective on who we bring on board to be a PocketRN nurse. There's a lot of great nurses out there. Um, there's not all of them are a good fit for PocketRN, right? So there is a very specific criteria that we look for as we bring new nurses on board. Um, it is the number one trusted profession, and I think that serves us well. And I think again, just thinking about who we bring on as nurses to really help all of you in that nurse for life journey, we take that very seriously, and that's very important to us. We do have, like I mentioned this, the physician and nurse practitioner oversight. And then again, that virtual first model with deep integration and experience in the home. While we don't have a direct to consumer route, we are, fully operational as an organization, and we are in the home. That is our like business model, I guess I'd say. So we do have a lot of experience just helping guide the journey with those in their home setting, not in the facility setting. Years of experience in delivering comprehensive proactive check-ins. Again, we'll meet with you often or not very often, just kind of depending on where you're at. And then with that nurse in your pocket model, you are able to reach out to us if you need us in a moment. That online training and education for paid and unpaid family caregivers. I mentioned Navon with the modules. That's what that is really getting to there. And then we have a national reach. So I meant to mention this earlier, but we are live in pretty much all 50 states. We have a few where we are working on getting our business license in. That has been a little bit more challenging, but we are hoping to have that up and ready by July 1st or very close to after July 1st to get that national reach. I think we are currently at 38 or 40 states. So we're really reaching that peak here very soon. But through the guide program, we will be in all 50 states. So we can cover, rural, urban. This is one of the best things about virtual. And again, that tie back to the convenience. We can really be anywhere that the patient or the family caregiver are. I'm going to go ahead and I think you can read that last bullet. And then how do you sign up? All right, great. So great question. I'm sure some of you are wondering. So the first step is to call us directly. We have a team. We call them the support team. They're amazing. They're so helpful. Us nurses would honestly not be able to do our job without this team. That's the first step. You'll give PocketRN a call, and then we will walk you through. We'll probably schedule you for a welcome call after July if you're calling today, for example. Schedule that welcome call for you and make sure we have all of the information that we need to gather. Again, I'll say this is a Medicare program, so of course there's lots of requirements and things that they want to know. So there is a lot of information that we as the participant in this program have said we will gather because this is what we're being told to do. So be patient with us if you're like, you've asked me 50 million questions. It can be a lot in the beginning. After you get through the process and into the program, it does become, I think, much less it doesn't feel like as much, I think, after that. So, and that's really when you begin to build that relationship with your nurse for life. So I think that's the end of my slide deck. So I'm going to go ahead and stop sharing and then just curious what questions we have.
Great. Anyone have any questions at all? Or need clarification on anything that we've discussed here? Just to reiterate, Amanda.
Yeah.
This is free through Medicare. It is run through Medicare through PocketRN. It is at no cost program.
Correct.
Okay.
And I forgot a thing. I'm so sorry because this is a really important thing about this program. So I'm going to go back on my slides here and talk about, I kind of skipped over this part and I didn't mean to, so please forgive me. But you're going to like this. So you're going to be glad that I remembered to talk about this. So through the program, you get your nurse for life. But one of the other benefits that we think is huge and that we love, I talked about home care. But what I didn't tell you was that through this program, for those that qualify, you can receive an annual respite benefit. And that respite benefit is $2,500. It resets every year on July 1. But what we are doing is we are partnering with home care agencies. So I don't know if you've ever heard of agencies like Right at Home, Home Instead, that's where I came from, Visiting Angels. So the home care agencies are not like home health. These are agencies that provide assistance with activities of daily living for older adults in their homes. So we are really partnering with these different home care agencies. And we have, I think we're up to 15 partnerships with national home care agencies to exercise this respite benefit. So this is $2,500. Medicare does kind of like set the rate for this. So just depending on where you live, it's about 70 hours of respite care a year. So that's another thing that you get as being a part of this program. Aren't you glad that I remembered to talk about this? Because this is like a big deal. This is huge. And Medicare has never done this before. I mean, it's amazing.
Very happy, very thankful. Yes.
Yeah.
Do they have to wait? Do we have to wait until July 1st to make this call? Or can they call now?
To call us.
Yep.
What we'll do if you call now, we will schedule you for a welcome call in July. So you could call now and get it scheduled, or you could, wait until after we begin in July.
Okay. Okay. And the respite benefit, it's up to the caregiver how they want to use that. In
It
what way, if they want to do a few hours a week, or if they want to take a week or whatever, it's up to them. It's not prohibited in different ways.
so I will say generally, yes. Some of our home care agencies, I think a lot of it depends on the staffing. So there might be some some limitations, or they would have to be a little bit flexible about how it's exercised in terms of like increments of hour. They do need to be used in 4-hour increments. That is a CMS policy on that. We can't do like 1 or 2 hours. But yes, generally it is open for interpretation on how it's used. But I think you would have to work with the individual, home care agency on that to really define that out further.
Okay. Okay. Yep. Clarification, PocketRN offers services outside of guide, but not business to consumer, directly to patients. How do patients access PocketRN? Is it through other companies, or can you give an example?
Yeah, it is through other companies at this point in time, but we are working on that direct to patient route.
Okay. Okay. Um,
So Guide is really the vehicle right now for PocketRN services.
right. Okay. Okay.
I saw, what is Navan again? That's the vendor that we use for, it's called a learning management system. They have basically modules about dementia, about caring for someone with dementia that you get access to as part of this program. And they are, again, convenient, self-led modules that you can do at any time. So if you're just, feeling like you could brush up your dementia skills, or you don't know much about, the disease, this would all be information that you would have access to as part of this guide program through PocketRN as well.
They're really great. They're really great. They're quick. They're friendly, which is important.
Yeah, yeah. I see. This is a good question. Do home care agencies for respite care have to be registered with Medicare, or can you go through any agency? They have to be registered with us because that's a requirement through Medicare, that any of the partners, will say, that we would use for that respite benefit need to be in a contractual relationship with the participant. So we would be able to find the home care agency in your area that we are partnered with to exercise that respite benefit.
Okay. Question, how do you get access to the online training if you don't qualify for the program?
That's a good question. We haven't thought about that, to be honest. So I think, what if someone was interested? We went through that whole eligibility process, that comprehensive assessment, and then for whatever reason, Medicare says, no, we're not going to accept you into the program. Would there still be some opportunity to get access to the education? Is that the question? That's what I'm thinking it is. Yeah. Okay. That's a great question. I'm going to take that and as a takeaway for us to see what we might be able to do there.
Okay. Wonderful. Thank you, Cheryl. Is there a max number of patients who will be accepted?
No.
Okay.
Well, not that they've ever said. So maybe at some point in time they might be like, okay, this is a lot more than we thought was. We know the need is out there, right? So I could see. I don't know that they'll do this, but I could see them being a little bit surprised by how many people actually enter into the program and want this service.
Agreed.
But as of now, there is no cap that we know of.
Okay. Is the caregiver and the patient involved in the first consultation?
Yes, 100%. It is actually critical that the caregiver is involved in that consultation. And best practice for us is that we have a few minutes to spend with the caregiver before we actually even meet the individual with dementia. So we gather a lot of information just through like an interview process with that family caregiver. And again, I think that convenience piece that we talked about, Roseanne, is really important. You don't have to be in the same like physical location with the individual. You can hop on the meeting from a separate location really easily. I think where it becomes difficult is if the patient, we need to see the patient, right? We can't do an assessment without being able to do that, is
Okay.
if they can't manage the technology. But if there's someone there that can help them manage the technology, the family caregiver doesn't need to be in the same physical location with them.
What happens if the person living with dementia is angry and doesn't want any mention
Yeah.
of anything? There's nothing wrong with them. What do you do with that?
Yeah, that's why we like that time with the family caregiver first, so we can start to really understand what that looks like and who they are in a day to day without having to ask them, are you incontinent? Do you wear a brief? You know, those things that like, I don't want people to ask me that, right? That's where we really start building that profile of kind of what the day to day looks like and what the care of that individual truly looks like. So that's why we ask for that time alone first.
Mm-hmm.
There are a specific set of questions that we have to get from the individual with dementia themselves. And we have encountered this where it makes them agitated. Again, I get it. Some of these questions are very uncomfortable. It doesn't make sense to them. It is a requirement of the program. So that's what I was saying earlier, like, you know, be patient with us. There is a lot that Medicare says we have to get. Um, they can refuse to. I mean, if we don't get all of the way through it, but we see that, you know, cognitive impairment there, we can still send that to Medicare to try to get them aligned into the program. Honestly, I don't know what they would do with that information at this point in time, but I still think it's worthy of, and for some of the questions we have to ask refused or unable to, you know, complete the questions is as much of an indicator as anything truly.
Okay. Okay. So it's not, I feel like it's part of um, everyone that's dealing with this knows they're dealing with people that are living with dementia. So there has to be a little fluidity here instead of just strictly here's the box and that's it.
Yeah.
Okay.
Yes, yes. And that's where I think the nurse piece comes in, where I think that's really valuable because you're right. Every day looks different, right? So it might be a bad day, it might be a good day. I don't
Right.
know. Who knows what it's going to look like at that moment when we're doing that comprehensive assessment and having to ask all of those questions. Unfortunately, again, there is a lot of required information because Medicare doesn't live in our fluid world. They live in a
No.
very black and white, right? So, but I do think that's where the nursing expertise comes in and helps kind of navigate that with the family caregiver
Okay. Is
and the
there,
patient.
thank you. Is there coverage in most rural and urban areas?
Yeah, anywhere with Wi-Fi.
Okay.
I think the tricky thing might be that respite benefit, just
Right.
depending on what location we're talking about. But again, this is why we have partnered with some of the biggest home care agencies in the nation, is to really expand that national footprint and get into literally every location in the US that we can.
Okay. Can respite care be used in event of emergency if the caregiver is hospitalized?
Um, I think that would have to go back to the home care agency and what they're able to accommodate in the moment.
Okay. Okay. Great. Um, when you expand into business to care, are you thinking going concierge or partnering with medical groups
Um,
or
oh,
unknown?
great question. I don't why not all? I mean, we believe everyone deserves to have a nurse in their pocket. So
Okay.
let's just go everywhere. I think probably actually both. So we will continue to have our, you know, B2B partners, B2B to B2B to C, I guess you'd say.
Mhm.
And then we'll also, I think, build out kind of more of that concierge or direct to consumer route.
Okay. Two kind of personal questions. Gail's interested in working for PocketRN. Who should she
Oh,
reach out
amazing.
to?
Okay.
And the caregiving agency she's using for her parents may be interested in teaming with PocketRN. So who would they contact?
Yeah. So send me an email, Gail. I just put it in the chat, and you can send me that information, and I'll work on getting that to the right person in the organization. And also, we can talk about employment opportunities as well.
Okay. Another question. What if the person had Alzheimer's dementia diagnosis, which was then taken away after an MRI revealed a stroke, brain bleeds, and TIAs? The MCI was diagnosed in 2020.
Yeah, I feel like that could be some vascular dementia, really. So,
Absolutely. Yep. Yep.
I mean, I don't know what Medicare would say, but I would say true.
Right.
So thank you. Mild cognitive impairment does not qualify. It has to meet the level of dementia, right? So mild cognitive impairment is below that. But that was 5 years ago. So why is it at the dementia level now or not? I don't know. That's a great question. Maybe this isn't the right approach, but this is kind of my thought process. And I think ours kind of as an organization is we gather the information and let Medicare make the ultimate decision on if there should be accepted, if they believe they meet the criteria or not to be accepted into the program. Now, I say that, and then I'll say we do have to provide some insight on what we believe is the severity of dementia. So sometimes our nurses will say, I just don't think there's enough here to qualify for the program. And that might happen too. So it's a good call out that mild cognitive impairment does not always meet the definition of dementia.
Okay. It sounds like too the nurses are very well equipped to handle lots of different questions and the whole breadth of the dementia world, which is very helpful and not normally what we're used to receiving. So Nicole, good question. Does the PocketRN nurse actually give a dementia diagnosis?
We do not. We do not diagnose as nurses, but we do have the ability with our, well, I would say billing providers, our physicians and nurse practitioners on staff to do that if we believe that is necessary to get into the program.
So flesh that out a little bit for me, if you don't mind.
Yeah. So I think our general thought, I mean, people are going to come to us, we'll say, with cognitive impairment. I think that's a good way to put it. And some will have a previous diagnosis of dementia, and some will not. And honestly, I think sometimes in the healthcare community, in the medical field, we kind of shy away from giving a dementia diagnosis. So we expect to have quite a few people that fall into this bucket of cognitive impairment to whatever degree, but no actual diagnosis. So they will follow a little bit different path where they might meet with the nurse practitioner, for example, versus one of the other nurses to be able to actually for us all to feel more confident, it could because they are the diagnosing provider, that there is a true that the cognitive impairment meets the definition of that true dementia diagnosis.
Okay. Thank you. Thank you.
Yeah.
Question. My experience as a full-time caregiver for my mom with vascular dementia has been that scheduling full-time, say for a full weekend or a week, respite care is really hard. Do you have any advice for that?
So I do believe that is tricky. Having a home care background, I will say a lot of that is dependent on their ability to staff for those times and days. So I do agree that that can be challenging. I do think there are many home care agencies out there, though, I would say. And so I don't think just because it doesn't work for one doesn't necessarily mean it wouldn't work for another.
Yeah. Yeah. Sometimes if you're able to find respite at a long-term care community, is that allowed in the respite benefit? So it's not technically long-term care living. It would just be for that respite because
short-term respite.
Some of them allow that.
That's a great question. I don't know the answer to that, so I don't want to speak to it. So it seems like that makes sense, but let me take that down as a follow-up.
Yeah, I don't know if the lines would cross because the payment would be for a long-term care community. So,
Yes. The other kind of caveat there, I'll say,
mhm,
hold on, let me write this down so I don't forget. Um, is that again, they have to be partnered with us
right.
to be able to exercise that respite benefit. And not that we couldn't partner with them, but there is a long process for them to go through with Medicare, and it's usually 10 weeks to get them on the quote unquote partner roster,
Yep.
if assuming that that community even wanted to. So that is an extra kind of layer of challenge and complexity there.
Sure.
But great question.
And it all comes with its own risks as well. Anytime, trying to move someone with dementia for a short-term respite is a challenge in and of itself. And it's
Yeah,
really your last
so
resort
true.
if you need it. That's what my thought was.
I will say, we've been doing a pilot with several home care agencies, and this was to get us ready for what we call Real Guide in July,
Mhm.
just to see like how does this work? What happens here? Let's make sure we kind of the operational excellence, right? Here we
Yeah,
are trying to really bring that in as one of our core pillars.
sure.
Um, and I mean, we have just an amazing story about a family. First of all, it was really the mom that we were looking at as bringing into the pilot program. And then it kind of came up when the nurse was doing the assessment, like, I think there might be something with the spouse, with the husband as well. So we ended up doing a comprehensive assessment on him. He actually, and long story short, but he didn't end up qualifying. But we were able to plug him into some other resources that he needed. But the one of the sons of this family, they live out of state, and they were getting married. And so the family used this respite. We had this, respite as an option in this pilot. They used that respite to take the mom, to take a caregiver with the mom to California where the wedding was. And she spent that's really how they used that respite benefit money. So the caregiver from the home care agency went along. She really helped the mom. And so the dad could just enjoy the time with the family. So she helped her get ready and, just kind of like was
Yep.
with her during the ceremony and things. So again, the family could just take that time and focus on all the other things that they were doing. And the dad especially didn't have to be the caregiver right there all of the time. And so that was one of the like we haven't even started the program yet. There's really one powerful and amazing story that we have coming out of this guide program and how people are looking to use that respite benefit. Again, that we don't manage that respite benefit. So I just want to be careful and clear that that all goes back to the home care agency and what they can and will allow in terms of like caregivers going out of state, for example.
Right.
So,
Okay.
but I just want to share that because that was such an amazing story for us
No,
here.
that's great. That's great. Thank you. I think this ties back to are they diagnosed or not? Do they consider family history? Sister passed with Alzheimer's, dad had dementia, nephew passed with stroke and cardiac arrest. Does that all come into play for qualification and diagnosis?
Um, this is part of the comprehensive assessment. And again, it is really comprehensive where we have to gather a lot of information and go through a lot of different screenings, I would say. So in really the point of that is to take all of this information in totality to get a clear picture of what the individual looks like
Yeah.
to I think, help everyone understand, is this is there cognitive impairment and does it meet the definition of dementia? Is there enough there to give that true diagnosis of dementia? So I think information like that is gathered along the way through this, from the welcome call with us to the comprehensive assessment and beyond. And once you start meeting with the nurse.
Okay, that's great. Another question. My husband currently has an MCI diagnosis. We are waiting on our 6-month visit at the end of July with the neurologist. His short-term memory
Mm.
loss has progressed a lot. Should I wait until after the 6-month visit before setting up an evaluation with guide?
Ooh, that's a good question. I would say, um, well, the timelines are so close. I don't know. I'm not sure what the right answer there is there. I would say go ahead and start the process to guide, because I think what will happen if they're eligible based on insurance is when you meet with the neurologist, if a actual dementia diagnosis is given, that ICD-10 code, that claims diagnosis code will be dropped and Medicare will be able to see that. And so I think it gives it a little bit more, power, honestly, to the program. So I think, yeah, totally. I would start the process of going through guide with us. And then that could be a really important piece, both for PocketRN and for Medicare.
Great. Great. Thank you.
These are good questions.
I told you they were going to come for
They
you.
keep me on my toes.
Yep. So we're just winding up. We have a few minutes left. If you have any other questions that you would like to ask Amanda. Yeah, agreed, Gail. Gail said guide is far from perfect, but given this is a Medicare program, it's pretty
Yeah.
impressive. As Amanda says, teeny tiny baby steps to get where we need to be. Amen. 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 It
Yeah.
is long coming and much needed. And I hope it sounds wonderful. When you first look at it, you're like, really, this can't be real.
Right.
Medicare's
For
doing this.
free?
Can't be for free. This isn't going to
Yeah.
cost me anything. Yeah. So it's wonderful. So, if anybody has any other questions, and I had the pleasure of interviewing Jenna Morgenstern Gaines for the podcast. It'll be released tomorrow. And she had such great takes, as part of our let's get as much information as we can to our community. She shared a lot. Amanda, I can't thank you enough for being here to answer all these questions and just, for everything that you do. We
Yeah, of course.
appreciate it. We're very thrilled that PocketRN is part of our world here, part of our orbit, and
Yeah.
we look forward to our continuing work with you and all the support that you can provide. So
Really, I should be thanking all of you because this is really where the real work comes in, right? Is that family caregiving piece. So thank you for bringing us all together. It was really a pleasure and a pleasure and an honor. I can't say that enough.
absolutely. Thank you. And again, the PocketRN number is 872-233-4490. I wish I had that little ticker tape, like, when you get on the commercials,
Across the
that
top.
number to call is, yeah,
I love it.
872-233-4490. Listen, all of this information is on our Daughterhood website, daughterhood.org. We have a new dementia and guide tab. All of the information is there. Frequently asked questions. We have a video. Anything that you need is on our website. So please feel free to go there. Like I said, the podcast comes out tomorrow. Please stay in touch with us on Facebook and Instagram. You know, if you need to reach us, you can always get us through our social media, through our info@Daughterhood. You can always reach us there. Pass on any of this information to anyone you think needs it. The newsletter, our social media posts, anything. We are here for you. We are here and we are set up to support you through this process. You are important. You are the most important part of the system, even though no one tells you that, you are. And we are here for you. So thank you, thank you, thank you. Amanda, thank you again. Everyone in the chat, thank you for your questions. You are all on top of your game. We are all very excited about this, Amanda. So thank you. Thanks for spending time with us today and going through all of this.